ನಮಸ್ಕಾರ. ದಿವ್ಯದಿಶಾ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ತಮಗೆಲ್ಲರಿಗೂ ಆತ್ಮೀಯವಾದಂತಹ ಸ್ವಾಗತ. ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ನಮ್ಮೊಂದಿಗಿದ್ದಾರೆ KMC ಹಾಸ್ಪಿಟಲ್ನ ಕನ್ಸಲ್ಟೆಂಟ್ ಲೋವರ್ ಲಿಂಬ್ ಆ್ಯಂಡ್ ಎಕ್ಸ್ಟೆನ್ಷನ್ ಸೆಂಟರ್. ಮೂಲತಃ ಒರಿಸ್ಸಾದವರಾದರೂ ಕೂಡ ಕರ್ನಾಟಕದಲ್ಲಿ ಬಂದು ತಮ್ಮ ವಿದ್ಯಾಭ್ಯಾಸವನ್ನು ಪೂರ್ಣಗೊಳಿಸಿ ಈಗ ಕರ್ನಾಟಕದ ಜನತೆಗೆ ತಮ್ಮ ಸೇವೆಯನ್ನು ನೀಡ್ತಾ ಇದ್ದಾರೆ. ಒರಿಸ್ಸಾ ಭಾಷೆ ಅಲ್ಲದೆ ಹಲವಾರು ಭಾಷೆಗಳನ್ನು ಕರಗತ ಮಾಡಿಕೊಂಡಿರುವಂತಹ ನಮ್ಮ ಡಾಕ್ಟರ್ ಬಿಶ್ವರಂಜನ್ ದಾಸ್ ಅವರು ರೋಗಿಗಳಿಗೆ ಅತ್ಯಂತ ಆತ್ಮೀಯವಾಗಿ ಪ್ರೀತಿಪೂರ್ವಕವಾಗಿ ಕನ್ಸಲ್ಟೆನ್ಸಿಯನ್ನು ಕೊಡ್ತಾರೆ. ಅವರ ದರ್ ಇಸ್ ಅ ಮ್ಯಾಜಿಕ್ ಇನ್ ಹಿಸ್ ವರ್ಡ್ಸ್ ಅಂತಲೇ ಹೇಳ್ಬೋದು. ಹಾಗಾಗಿ ಅವರ ಮಾತುಗಳಿಗೆ ಹಾಗೆಯೇ ಅವರ ಪರಿಣತಿಗೆ ನನಗೆ ಬಹಳ ದಿನಗಳಿಂದ ನಾನು ಆಲೋಚನೆ ಮಾಡ್ತಾ ಇದ್ದೆ ಡಾಕ್ಟರ್ ಬಿಶ್ವರಂಜನ್ ದಾಸ್ ಅವರನ್ನು ಇಂಟರ್ವ್ಯೂ ಮಾಡಬೇಕು ಅಂತ. ಹಾಗಾಗಿ ಇವತ್ತು ನಮಗೆ ಅವಕಾಶ ಸಿಕ್ಕಿದೆ. ಅವರಿಗೆ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಮತ್ತೊಮ್ಮೆ ಪ್ರೀತಿಪೂರ್ವಕವಾಗಿ ಸ್ವಾಗತಿಸ್ತಾ ಇದ್ದೇನೆ. ಸ್ವಾಗತ ಸರ್.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್.
ಸರ್, ಫಸ್ಟ್ ಆ್ಯಂಡ್ ಫಾರ್ಮೋಸ್ಟ್ ನಾನು ಹೇಳಿದ ಹಾಗೆ ನೀವು ಒರಿಸ್ಸಾದಿಂದ ಬಂದಿದ್ದೀರಿ. ಸೊ ಹೌ ಕಮ್ ಇನ್ ಕರ್ನಾಟಕ?
ಸೊ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ದ ಲವ್ಲಿ ಇಂಟ್ರೊಡಕ್ಷನ್ ಮೇಡಮ್. It's been almost 11 years now.
Okay.
So coming to Mangalore was a pure accident.
Okay.
It was never meant to be. One of my professor was from Mangalore, so that's how I came to Mangalore, and probably destiny had other plans.
Okay.
So this is the 11th year I'm here in Mangalore. And it's probably initially the education, but then I realized Mangalore is a place where medical growth is exponentially increasing. And people here are very welcoming, if I can put it in that way. And that's why probably I started liking Mangalore, started liking Kannadigas.
Okay.
And now I consider myself a half Kannadiga at least.
Yes.
ಯಾಕೆಂದರೆ ಈಗ ಆಬ್ವಿಯಸ್ಲಿ ಮೈ ಎಜುಕೇಷನ್ ಆ್ಯಂಡ್ ಮೈ ಮದರ್ ಟಂಗ್ ಇಸ್ ಫ್ರಮ್ ಡಿಫ್ರೆಂಟ್ ಪ್ಲೇಸ್, ದಟ್ ಈಸ್ ಒಡಿಸ್ಸಾ, ಭುವನೇಶ್ವರ್. ಬಟ್ ನಾವು ಐ ಸ್ಪೀಕ್ ಕನ್ನಡ. ಸೊ ಇಲ್ಲಿಗೆ ಬಂದಿದ್ದ ನಂತರ ಈಗ ಕನ್ನಡ ಮಾತಾಡಲಿಕ್ಕೆ ಆಗ್ತದೆ. ಸೊ ಯಾಕೆಂದರೆ ಈ ಭಾಷಾದಲ್ಲಿ ಮಾತಾಡೋದಿಲ್ಲ ಅಂದರೆ ಇಟ್ ಬಿಕಮ್ಸ್ ಡಿಫಿಕಲ್ಟ್. ಯಾಕೆಂದರೆ ನನಗೆ ಎಕ್ಸ್ಪೆಕ್ಟೇಷನ್ ತುಂಬ ಜನಕ್ಕೆ ಏನಿರ್ತದೆ ಕಿ ದ ಪೇಷಂಟ್ ಶುಡ್ ಸ್ಪೀಕ್ ದ ಡಾಕ್ಟರ್ಸ್ ಲ್ಯಾಂಗ್ವೇಜ್. ಬಟ್ ಅದರಲ್ಲಿ ಏನಾಗ್ತದೆ, ಪೇಷಂಟ್ ದ ರಿಯಲ್ ಪ್ರಾಬ್ಲಮ್ ನನಗೆ ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಸೊ ಅವರಿಗೆ
ಮನವರಿಕೆ ಮಾಡಬೇಕು.
ಎಕ್ಸಾಕ್ಟ್ಲಿ. ಸೊ ನಾನು ಅವರು ಲ್ಯಾಂಗ್ವೇಜಲ್ಲಿ ಮಾತಾಡ್ತಾರೆ ಅಂದರೆ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಹಿಸ್ಟ್ರಿ ಕ್ಲಿಯರ್ಲಿ ಗೊತ್ತಾಗ್ತದೆ. ಯಾಕಂದರೆ ಈ ಪ್ರೊಫೆಷನಲ್ಲಿ 70% ಟ್ರೀಟ್ಮೆಂಟ್ ಒಂದು ಕರೆಕ್ಟ್ ಹಿಸ್ಟ್ರಿ ಮಾಡಿದೆ ಅಂದರೆ, ಹಿಸ್ಟ್ರಿ ಟೇಕಿಂಗ್ ಮಾಡಿದೆ ಅಂದರೆ ಈಸಿ ಆಗತ್ತೆ. ಸೊ ಅದಕ್ಕೆ ಈ ಭಾಷೆಗೆ ಸ್ವಲ್ಪ ಈಗ ಲೈಕ್ನೆಸ್ ಸ್ವಲ್ಪ ಡೆವಲಪ್ ಆಗಿದೆ. ಆ್ಯಂಡ್ ಅಫ್ಕೋರ್ಸ್ ಸ್ವಲ್ಪ ಗ್ರಾಮ್ಯಾಟಿಕಲ್ ಎರರ್ಸ್ ಇದೆ, ಬಟ್ ಪೇಷಂಟ್ಸ್ ಆರ್ ಎನ್ಕರೇಜಿಂಗ್. ಯಾಕೆ ಅಂದರೆ when they see somebody putting effort to learn their language, so ಆ ಟೈಮಲ್ಲಿ ಸ್ವಲ್ಪ ಕೋಪರೇಷನ್ ಜಾಸ್ತಿ ಬರ್ತದೆ. ಸೊ ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ಈಸಿ ಆಗಿದೆ. ಅದು ಒಂದು ವಿಷಯ. ಸೆಕೆಂಡ್ ಅಂದರೆ ನಾನು ಗ್ರಾಜುಯೇಷನ್ ದಟ್ ಈಸ್ ಬ್ಯಾಚುಲರ್ ಇನ್ ಫಿಸಿಯೋಥೆರಪಿ ಒಡಿಸ್ಸಾದಲ್ಲಿ ಮಾಡಿದೆ. ನಾನು ಮಾಸ್ಟರ್ಸ್ ದಟ್ ಈಸ್ MPT ಇನ್ ಆರ್ಥೋಪೆಡಿಕ್ಸ್ ಆ್ಯಂಡ್ ಮಸ್ಕುಲೋಸ್ಕೆಲಿಟಲ್ ಪ್ರಾಬ್ಲಮ್ ರಿಲೇಟೆಡ್ ಟು ಸ್ಪೋರ್ಟ್ಸ್. ಅದು ಆಲ್ವಾಸ್ ಕಾಲೇಜಲ್ಲಿ ಮಾಡಿದೆ, ಆಲ್ವಾಸ್ ಕಾಲೇಜ್ ಆಫ್ ಫಿಸಿಯೋಥೆರಪಿ ಮೂಡುಬಿದ್ರಿಯಲ್ಲಿ. ಅದು ನಂತರ ನಾನು ಈಗ ಕರೆಂಟ್ಲಿ PhD ಮಾಡ್ತಾ ಇತ್ತು. ನಾನು ಸ್ಪೆಷಲ್ ಇಂಟ್ರೆಸ್ಟ್ ಗೇಟ್ ಟ್ರೈನಿಂಗ್ ಅಂದರೆ ಹೇಗೆ ಜನ ನಡೀತಾರೆ. ಯಾಕಂದರೆ ಎಲ್ಲ ಜನಕ್ಕೆ ವಾಕಿಂಗ್ ಸ್ಟೈಲ್ ಡಿಫ್ರೆಂಟ್. ಈಗ 70-20% ಆಫ್ ದ ಟೈಮ್ ಕರೆಕ್ಟ್ ವಾಕಿಂಗ್ ಅಸೆಸ್ ಮಾಡಿದೆ ಅಂದರೆ ಅರ್ಧ ಪ್ರಾಬ್ಲಮ್ ಆ ಸ್ಟೇಜಲ್ಲಿ ಪ್ರಿವೆಂಟ್ ಮಾಡಲಿಕ್ಕೆ ಆಗುತ್ತೆ. ಸೊ ಅದಕ್ಕೆ ಒಂದು ಪಬ್ಲಿಕ್ ಸರ್ವಿಸ್ ಮತ್ತು ಪಬ್ಲಿಕ್ಗೆ ಒಂದು ಈ ಥರದ್ದು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟಿದೆ ಅಂದರೆ ಸ್ವಲ್ಪ ಬೆನಿಫಿಟ್ ಜಾಸ್ತಿ ಸಿಗ್ತದೆ ಸೊಸೈಟಿಗೆ. ಅದಕ್ಕೆ ನಾನು ಅದು ವಿಷಯದಲ್ಲಿ ಈಗ PhD ಮಾಡ್ತಾ ಇತ್ತು. ಈಗ ಕಂಟಿನ್ಯೂಸ್ಲಿ ನಾನು NITK ನ್ಯಾಷನಲ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಟೆಕ್ನಾಲಜಿ ಕರ್ನಾಟಕ, ಅದರಲ್ಲಿ ಆ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಅಲ್ಲಿ PhD ಮಾಡ್ತಾ ಇತ್ತು. ಪ್ಲಸ್ KMC ಅಲ್ಲಿ ಈಗ ನನಗೆ 8 years ಕಂಪ್ಲೀಟ್ ಆಗಿದೆ, ಈಗ 9 years ಚಾಲು ಇದೆ. ಸೊ ನಾನು ಈಗ ಸ್ಪೆಷಲೈಸೇಷನ್ ಗೇಟ್ ಟ್ರೈನಿಂಗ್ ರಿಲೇಟೆಡ್ ಟು ಕಾಲ್ ಮತ್ತು ಮಂಡಿ ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್. ಸೊ ಅದು ಒಂದು ಆಲ್ಮೋಸ್ಟ್ ಆ ಏರಿಯಾದಲ್ಲಿ ನಾನು ಫೋಕಸ್ ಇದೆ.
ಸೊ ಬಿಫೋರ್ ಗೋಯಿಂಗ್ ಟು ದ ಆ್ಯಕ್ಚುಯಲ್ ಟಾಪಿಕ್, ಐ ವಾಂಟೆಡ್ ಟು ನೋ ಲೈಕ್ ನಿಮ್ಮ ಆ ಪ್ರೊಫೆಸರ್ ಯಾರು ಅಂತ ಕೇಳ್ಬೋದಾ? ನಿಮ್ಮನ್ನು ಇಲ್ಲಿ ಕಡೆ ಬರುವಂತೆ ಮಾಡಿ ಪ್ರೊಫೆಸರ್.
ಹೌದು, ಪ್ರೊಫೆಷನ್ ಒಂದು ಫಿಸಿಯೋಥೆರಪಿ ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ ಇತ್ತು. ಅವರು ಸಾರ್ ಈಗ ಒಂದು ಬೇರೆ ಕಾಲೇಜಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇತ್ತು ಮೈಸೂರಲ್ಲಿ. ಸೊ ಹೀ ಎನ್ಕರೇಜ್ ಮೀ ಟು ಕಮ್ ಡೌನ್ ಟು ಮ್ಯಾಂಗ್ಳೂರ್. ಅದು ಮ್ಯಾಂಗ್ಳೂರ್ ಬಂದಿದ್ದ ನಂತರ ನಾನು ಮೀಟ್ ಮಾಡಿದೆ ಡಾಕ್ಟರ್ ಯೋಗೀಶ್ ಕಾಮತ್ಗೆ. ಅವರು ಕನ್ಸಲ್ಟೆಂಟ್ ಹಿಪ್ ಅಂಡ್ ನೀ ಸರ್ಜನ್ KMC ಹಾಸ್ಪಿಟಲ್ದಲ್ಲಿ. ಅವ್ರ ಜೊತೆಗೆ ನಾನೀಗ ಆಲ್ಮೋಸ್ಟ್ 8 years ಅಲ್ಲಿ ಒಂದು ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇತ್ತು. ಸೊ ಹೀ ಈಸ್ ಸಾರ್ಟ್ ಆಫ್ ಮೈ ಗುರು ಹೂ ಎನ್ಕರೇಜ್ಡ್ ಮೀ ಟು ಬಿ ಎ ಬೆಟರ್ ಹ್ಯೂಮನ್ ಬೀಯಿಂಗ್ ಫಸ್ಟ್ ಆಫ್ ಆಲ್. ಅದ ನಂತರ ಟು ಬಿಕಮ್ ಎ ಬೆಟರ್ ಸ್ಪೆಷಲಿಸ್ಟ್. ಯಾಕಂದರೆ ಒಂದು ಆರ್ಥೋಪೆಡಿಕ್ ಸರ್ಜನ್ ಮತ್ತು ಒಂದು ಫಿಸಿಯೋಥೆರಪಿಸ್ಟ್ಗೆ ಕೊಲಾಬ್ರೇಷನ್ ಆಗಿದೆ ಅಂದರೆ ಪೇಷಂಟ್ಗೆ ಜಾಸ್ತಿ ಬೆನಿಫಿಟ್ ಸಿಗ್ತದೆ. ಆ ಥರದ್ದು ಮೈಂಡ್ ಸೆಟ್ ಇದೆ. ಪ್ಲಸ್ ಅರ್ಲಿ ಸ್ಟೇಜ್ಗೆ ಕಂಡೀಷನ್ ಡಯಾಗ್ನೋಸ್ ಆಗಿದೆ ಅಂದರೆ ಪರ್ಟಿಕ್ಯುಲರ್ ರಿಲೇಟೆಡ್ ಟು ಆರ್ಥೋಪೆಡಿಕ್ಸ್, ಅದು ಆರ್ಥರೈಟಿಸ್ ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್ ಆರ್ ಇಂಜುರಿ ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್, ಅರ್ಲಿ ಸ್ಟೇಜ್ಗೆ ಡಯಾಗ್ನೋಸ್ ಆಗಿದೆ ಅಂದರೆ ಒಂದು ಲಾರ್ಜ್ ಪೋರ್ಷನ್ ಎಕ್ಸಸೈಸ್ ಟ್ರೀಟ್ಮೆಂಟಲ್ಲಿ ಸರಿಯಾಗತ್ತೆ. ಸೊ ಅವ್ರಿಗೆ ಮೈಂಡ್ ಸೆಟ್ ಹೇಗೆ ಕಿ ಇನಿಷಿಯಲಿ ಅಷ್ಟಾಗ್ತದೆ, ಇಷ್ಟೇ ನಾನ್ ಸರ್ಜಿಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಟ್ರೈ ಮಾಡುವ. ಆ್ಯಂಡ್ ಇದರಲ್ಲಿ ಏನಾಗುತ್ತೆ, ರಿಕವರಿಗೆ ಚಾನ್ಸ್ ಇದೆ. ಸೆಕೆಂಡ್ ಆಫ್ ಆಲ್ ಏನಾಗ್ತದೆ, ನಿಮಗೆ ಅವೇರ್ನೆಸ್ ಬರ್ತದೆ, ಯುವರ್ ಹೆಲ್ತ್ ಈಸ್ ಇನ್ ಯುವರ್ ಹ್ಯಾಂಡ್. ಸೊ ಅದಕ್ಕೆ ಬೆನಿಫಿಟ್ ಜಾಸ್ತಿ ಸಿಗ್ತದೆ. ಆಬ್ವಿಯಸ್ಲಿ ಕಾಸ್ಟ್ ಎಕ್ಸ್ಪೆಂಡಿಚರ್ ತುಂಬ ಕಮ್ಮಿ ಇರ್ತದೆ, ಅದು ಒಂದು ವಿಷಯ. ಪ್ಲಸ್ ಸೆಕೆಂಡ್, ಎಲ್ಲ ಟೈಮ್ಗೆ ಸರ್ಜರಿ ಆಪ್ಷನ್ಸ್ ಇರುವುದಿಲ್ಲ. ಸೊ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಯಂಗ್ ಏಜ್ಗೆ ಸವಿದೆ ಆಗಿದೆ ಅಂದರೆ ಸರ್ಜರಿ ಆಬ್ವಿಯಸ್ಲಿ ಎಲ್ಲ ಜನಕ್ಕೆ ಗೊತ್ತು ಕಿ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಸರ್ಜರಿ ಬೇಕಾಗ್ತದೆ ಅಥವಾ ಸಮ್ ಸಾರ್ಟ್ ಆಫ್ ಸರ್ಜಿಕಲ್ ಪ್ರೊಸೀಜರ್ ಬೇಕಾಗ್ತದೆ. ಅದು ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಸರ್ಜರಿ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಅದಕ್ಕೆ ಆವ್ರೇಜ್ ಏಜ್ ಅಕಾರ್ಡಿಂಗ್ ಟು WHO ಈಸ್ 65 and above. So 65 to 72. ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಬಿಕಾಸ್ ಆಫ್ ಬ್ಯಾಡ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಸುಮಾರು ಜನಗೆ 25-30 years ಅಲ್ಲಿ ಸವಿದೆ ಆಗ್ತದೆ. ಸೊ ಆ ಸ್ಟೇಜಲ್ಲಿ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಸರ್ಜರಿ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗುದಿಲ್ಲ. ಸೊ ಆ ಥರದ್ದು ಕಂಡೀಷನ್ ಅಥವಾ ಸ್ಪೋರ್ಟ್ಸ್ ಇಂಜುರಿ ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ, ವಿ ಆರ್ ಬ್ಲೆಸ್ಡ್ ದಟ್ ವಿ ಆರ್ ಇನ್ ಮ್ಯಾಂಗ್ಳೂರ್, ಕರ್ನಾಟಕ, ದಕ್ಷಿಣ ಕನ್ನಡ ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ. ಇದರಲ್ಲಿ ಐ ಹ್ಯಾವ್ ಸೀನ್ ಲಾಟ್ ಆಫ್ ಯಂಗ್ ಪೀಪಲ್ ಆರ್ ಇನ್ ಟು ಸ್ಪೋರ್ಟ್ಸ್, ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ athletics. They are into hockey. Hockey is very much famous around this area. So all those things obviously leads to injury. And out of all the injury, knee injury is one of the commonest injury. Out of 10, at least 6 people do suffer with knee related injury. Commonest is ligament injury or meniscus related injury. Lot of times athletes rush into surgery and they end up with complications. Whereas if you diagnose properly, actually there are lot of injuries can heal on its own, may not require surgical intervention. So obviously when it is required, it has to be done. But there are times where we can manage without surgery. Will be an ideal platform to try with exercises. Exercises doesn't mean to visit a physiotherapist every day. As a specialist, what we encourage is to have a proper diagnosis and have a set protocol, so that we can have targeted rehabilitation. And depending upon how the patients are recovering, we can modify their exercise program rather than making it more commercial or making the patient or athlete dependent on the therapist or on certain equipments. So my mindset is more towards ಎಜುಕೇಟಿಂಗ್ ದ ಪೇಷಂಟ್. ಯಾಕೆಂದರೆ 50% ಟ್ರೀಟ್ಮೆಂಟ್ ಸ್ಟಾರ್ಟ್ಸ್ ವಿತ್ ಹ್ಯಾವಿಂಗ್ ಪ್ರಾಪರ್ ಎಜುಕೇಷನ್ ಅಬೌಟ್ ಯುವರ್ ಕಂಡೀಷನ್. ಸೊ ದೆನ್ ದ ಜಾಬ್ ಆಫ್ ದ surgeon or the physiotherapist becomes much easier.
Okay.
And obviously patient effort ಜಾಸ್ತಿ ಇದೆ ಅಂದರೆ ರಿಕವರಿ ಈಸಿ ಆಗುತ್ತೆ.
ಓಕೆ. ಸೊ ನಾವು ಸರ್ ಈಗ ಫಸ್ಟ್ ಥಿಂಗ್ ಅಂದರೆ ನಾರ್ಮಲ್ ಪೇಯ್ನ್, ಏನಾದರೂ ಜಾಯಿಂಟ್ ಪೇಯ್ನ್ ಇರ್ಬೋದು ಅಥವಾ ನೆಕ್ ಪೇಯ್ನ್ ಇರ್ಬೋದು, ರೆಗ್ಯುಲರ್ ಆಗಿ ಬರುವಂತಹ ಪೇಯ್ನನ್ನು ತುಂಬ ಹೊತ್ತು ಕೂತಾಗ ಇಲ್ಲಿ ಈಗ ನೀ ಪೇಯ್ನ್ ಬರ್ತದೆ, ಅಂತಹ ಪೇಯ್ನನ್ನು ಯೂಶ್ವಲಿ ಐ ಥಿಂಕ್ ಆಲ್ಮೋಸ್ಟ್ 80% ಆಫ್ ದ ಪೀಪಲ್ ವಿ ಇಗ್ನೋರ್ ದೆಮ್.
ಅಬ್ಸಲ್ಯೂಟ್ಲಿ.
ಸೊ ಈಸ್ ಇಟ್ ಗುಡ್ ಆರ್ ಬ್ಯಾಡ್?
ಸಿ, ಈಗ ಇದು ಅರ್ಲಿ ಏಕ್ಸ್ ಅಂಡ್ ಪೇನ್ಸ್, ಮಂಡಿ ನೋವಾಗಿದೆ ಅಥವಾ ಸೊಂಟ ಪೇನ್ ಆಗಿದೆ ಅಥವಾ ನೆಕ್ ಪೇನ್ ಆಗಿದೆ, ಈಗ ಈ 21st ಸೆಂಚುರಿಯಲ್ಲಿ ಅದಕ್ಕೆ ಮೇನ್ ರೀಸನ್ ಈಸ್ ಬ್ಯಾಡ್ ಪೋಸ್ಚರ್.
ಓಕೆ.
ಕೋವಿಡ್ ಬಂದಿದೆ, ವರ್ಕ್ ಫ್ರಮ್ ಹೋಮ್, ಈಗ ಎಲ್ಲ ಜನಗೆ ಎಜುಕೇಶನ್ ಲ್ಯಾಪ್ಟಾಪ್ ಮತ್ತೆ ಕಂಪ್ಯೂಟರಲ್ಲಿ ಇರ್ತದೆ. ಚಿಕ್ಕ ಚಿಕ್ಕ ಮಗಳು ನೋಡ್ಬೋದ, ಯಾವಾಗ್ಲೂ ಈ ತರದ್ದು ಕುತ್ಕೊಂತಾರೆ ಮತ್ತೆ ಟಿವಿ ನೋಡ್ತಾರೆ, ಕಂಪ್ಯೂಟರ್ ನೋಡ್ತಾರೆ. ಅದರಲ್ಲಿ ಏನಾಗುತ್ತೆ, ಮಸಲ್ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಆಗುತ್ತೆ. ಅಂಡ್ ಮಸಲ್ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಆಗಿದೆ ಅಂದರೆ ಆಟೋಮೆಟಿಕಲಿ ನೋವು ಬರ್ತದೆ. ಇದು ಬ್ಯಾಡ್ ಪೋಸ್ಚರ್ ರಿಲೇಟೆಡ್. ಸೆಕೆಂಡ್ ಕಾಮನ್ ರೀಸನ್ ಅಂದರೆ ಈಗ ನೋಡಿದ್ರೆ ತುಂಬ ಜನ ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ ಸಿಟ್ಟಿಂಗ್ ಜಾಬ್ ಹೋಲ್ಡರ್, ಬ್ಯಾಂಕರ್ಸ್ ಅಥವಾ IT ಪ್ರೊಫೆಷನಲ್ ಕಂಟಿನ್ಯೂಸ್ಲಿ ಒಂದು ಪೊಸಿಷನ್ಗೆ ಕೂತ್ಕೊಳ್ತಾರೆ. ಅದ್ರ ರಿಲೇಟೆಡ್ ಏನಾಗುತ್ತೆ, ಜಾಯಿಂಟಲ್ಲಿ ಸ್ವಲ್ಪ ಪ್ರೆಷರ್ ಜಾಸ್ತಿ ಬರ್ತದೆ, ಮಸಲ್ಸ್ ಬೇಗ ಟೈಟ್ ಆಗುತ್ತೆ. ಮಸಲ್ ಟೈಟ್ ಆಗಿದೆ ಅಂದರೆ ಆಟೋಮೆಟಿಕಲಿ ಜಾಯಿಂಟಲ್ಲಿ ಲೋಡ್ ಜಾಸ್ತಿ ಬರ್ತದೆ. ಆ್ಯಂಡ್ ಲೋಡ್ ಬಂದಿದೆ ಅಂದರೆ ದಟ್ ಈಸ್ ಬೇಸಿಕಲಿ ಬಿಗಿನಿಂಗ್ ಆಫ್ ದ ಎಂಡ್. ಸೊ ಯಾಕೆಂದರೆ ಗಾಡ್ ಹ್ಯಾಸ್ ಕ್ರಿಯೇಟೆಡ್ ಅವರ್ ಬಾಡಿ ಇನ್ ಎ ಸರ್ಟನ್ ಮ್ಯಾನರ್ ದಟ್ ಆಲ್ ದ ಪಾರ್ಟ್ಸ್ ಆರ್ ಮೂವಿಂಗ್ ಫ್ರೀಲಿ. ಒಂದು ಪಾರ್ಟ್ ಕರೆಕ್ಟ್ಲಿ ಫಂಕ್ಷನ್ ಆಗೋದಿಲ್ಲ ಅಂದರೆ ಹೋಲ್ ಸಿಸ್ಟಮ್ ಡಿಫಾಲ್ಟ್ ಆಗುತ್ತೆ. ಸೊ ಅದು ಒಂದು ಸೆಕೆಂಡ್ ರೀಸನ್. ಥರ್ಡ್ ರೀಸನ್ ಅಂದರೆ ಒಂದು ಜೆನೆಟಿಕ್ಸ್ ಅಂದರೆ ನೀವು ನೋಡ್ಬೋದಾ, ತುಂಬ ಯಂಗ್ ಕಿಡ್ಸ್ ತುಂಬ ಫ್ಲೆಕ್ಸಿಬಲ್, ಅವರಿಗೆ ಸರ್ಟನ್ ಆಕ್ಟಿವಿಟೀಸ್ ತುಂಬ ಈಸಿಲಿ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತದೆ. ಅದು ಎಲ್ಲ ಜನಕ್ಕೆ ಆ ಪವರ್ ಇಲ್ಲ. ಹ್ಯಾವಿಂಗ್ ಫ್ಲೆಕ್ಸಿಬಿಲಿಟಿ ಇಸ್ ಗುಡ್, ಬಟ್ ಓವರ್ ಫ್ಲೆಕ್ಸಿಬಿಲಿಟಿ ಕ್ಯಾನ್ ಲೀಡ್ ಟು ಮೋರ್ ಜಾಯಿಂಟ್ ಡ್ಯಾಮೇಜ್. ಸೊ ದ್ಯಾಟ್ can lead to early arthritis as well as can develop more wear and tear, not in the spine but also in all the major joints. ಸೊ ಅದು ಹೇಳ್ತಾರೆ ಜೆನೆಟಿಕ್ ಫ್ಯಾಕ್ಟರ್ ಅಂದರೆ ಡಿಸ್ಪ್ಲಾಸ್ಟಿಕ್, ಸರ್ಟನ್ ಟೈಪ್ ಆಫ್ ಬೋನ್ ಫೀಚರ್ ಇರ್ತದೆ. ಬೋನ್ಗೆ ಕರೆಕ್ಟ್ ಸೇಪ್ ಇಲ್ಲ ಅಂದರೆ ಅದು ಸಹ ಯಂಗ್ ಏಜಲ್ಲಿ ಎಕ್ಸ್ ಅಂಡ್ ಪೇನ್ಸ್ ಕೊಡ್ತಾರೆ. ಮತ್ತೆ ಫೋರ್ತ್ ರೀಸನ್ ಅಂದರೆ ಏಜ್ ರಿಲೇಟೆಡ್ ಆರ್ಥರೈಟಿಸ್. ಏಜ್ ರಿಲೇಟೆಡ್ ಆರ್ಥರೈಟಿಸ್ ಅಂದರೆ ಎಲ್ಲ ಜನಕ್ಕೆ ಆಫ್ಟರ್ ಸರ್ಟನ್ ಏಜ್ ಆರ್ಥರೈಟಿಸ್ ಬರ್ತದೆ. ಅದು ನಾರ್ಮಲ್, ಯಾಕಂದ್ರೆ ಅದು ನಾರ್ಮಲ್ ಏಜ್ ರಿಲೇಟೆಡ್ ಪ್ರೊಸೆಸ್, ಡಿಜನರೇಷನ್. ಬಟ್ ಈಗ ಏನಾಗಿದೆ, ಬಿಕಾಸ್ ಆಫ್ ಬ್ಯಾಡ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಆ ಏಜ್ ಗ್ರೂಪ್ ಸ್ವಲ್ಪ ಬೇಗ ಬಂದಿದೆ. ಸೊ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಪ್ರೀವಿಯಸ್ಲಿ ಅವರ್ ancestors or forefathers, they used to live 100 years. They had never gone to a doctor for knee replacement surgery. But ega half of my OPDs are actually filled with young people below 30. So imagine if 30 years people, people below 30 coming to OPD with neck pain, back pain and knee pain at this age, the way life is going on, imagine them after 20 years. They will probably end up with replacement surgery or some sort of surgical procedure. That is not good.
By the time they reach 40, they will have...
Absolutely. That's why young age ಅಲ್ಲಿ ಈ ಎಲ್ಲ early aches and pains, ಮಂಡಿಗೆ, ನೆಕ್ಗೆ, ಅದು ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡಬಾರ್ದು. ಕರೆಕ್ಟ್ ಸ್ಪೆಷಲಿಸ್ಟ್ಗೆ ತೋರಿಸಿದೆ ಅಂದರೆ ನಿಮಗೆ ಕರೆಕ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಸಿಗ್ತದೆ. ಓಕೆ, ಅಪ್ ಟು 70-75% ಟೈಮ್ ಕರೆಕ್ಟ್ ಡಯಾಗ್ನೋಸ್ ಆಗಿದೆ ಅಂದರೆ ವಿತ್ ಎಕ್ಸಸೈಸ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದು ಕಂಪ್ಲೀಟ್ಲಿ ರಿವರ್ಸ್ ಮಾಡಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಓಕೆ, ಸೊ ಡೆಫಿನೆಟ್ಲಿ ಯಂಗ್ ಏಜ್ಗೆ ಯಾವುದು ಥರದ್ದು ಏಕ್ಸ್ ಆ್ಯಂಡ್ ಪೇನ್ಸ್ ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡಬಾರ್ದು.
ಓಕೆ, ಸೊ ನೀವು ಹೇಳ್ತೀರಿ, ಈಸ್ ಇಟ್ ಬಿಕಾಸ್ ಆಫ್ ದ ಫುಡ್ ಸ್ಟೈಲ್ ಆಲ್ಸೋ?
ಅಬ್ಸಲ್ಯೂಟ್ಲಿ ಯಾಕಂದ್ರೆ ಬಾಡಿಗೆ ಸಟನ್ ಥರದ್ದು ಫುಡ್ ರಿಕ್ವೈರ್ಮೆಂಟ್ ಇರ್ತದೆ, ಸಟನ್ ಅಮೌಂಟ್ ಆಫ್ ಕಾರ್ಬೋಹೈಡ್ರೇಟ್, ಪ್ರೋಟೀನ್ ಆ್ಯಂಡ್ ಫ್ಯಾಟ್. ಈಗ ಏನಾಗಿದೆ ಎಲ್ಲ ಪ್ರೊಸೆಸ್ಡ್ ಫುಡ್ಡಲ್ಲಿ ಏನಾಗುತ್ತೆ ನಿಮಗೆ ಬಾಡಿಗೆ ಪ್ರಾಪರ್ ನ್ಯೂಟ್ರಿಷನಲ್ ಸಪ್ಲಿಮೆಂಟ್ ಸಿಗೋದಿಲ್ಲ. ಸೊ ಅದಕ್ಕೆ ನೀವು ನೋಡಿದೆ ಈಗ ಅಟ್ಲೀಸ್ಟ್ 15-20% ಸೊಸೈಟಿ ಆರ್ ಸಫರಿಂಗ್ ವಿತ್ ಒಬೆಸಿಟಿ ಅಂದರೆ ಕರೆಕ್ಟ್ ಫುಡ್ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಇಲ್ಲ ಅಂದರೆ ಈ ಥರದ್ದು ಪ್ರಾಬ್ಲಮ್ ಬರಲಿಕ್ಕೆ ಚಾನ್ಸ್ ಇದೆ. ಅಬ್ಸಲ್ಯೂಟ್ಲಿ. ಪ್ಲಸ್ ಈಗ ನೀವು ನೋಡಿದೆ ಅಟ್ಲೀಸ್ಟ್ 50-60% ಯಂಗ್ ಜನ ಆರ್ ಡಿಪೆಂಡೆಂಟ್ ಆನ್ ಫಾಸ್ಟ್ ಫುಡ್. ಎಲ್ಲ ಫಾಸ್ಟ್ ಬೇಕು. ಸೊ ಈಗ ನಾರ್ಮಲ್ ಅನ್ನ ಸಾಂಬಾರ್ ತಿನ್ಲಿಕ್ಕೆ ಇಷ್ಟ ಇಲ್ಲ, ಬಟ್ ಒಂದು ಬರ್ಗರ್ ಕೊಡ್ತಾರೆ ಅಂದ್ರೆ ತುಂಬಾ ಪ್ರೀತಿ. ಬರ್ಗರ್, ಕೋಕ್, ಪಿಜ್ಜಾ ಆ ಥರದ್ದು ಫುಡಲ್ಲಿ ಇದು ಎಲ್ಲ ಪ್ರೊಸೆಸ್ಡ್ ಫುಡ್. ಅದರಲ್ಲಿ ನಿಮಗೆ ಫ್ಯಾಟ್ ಲೆವೆಲ್ ಜಾಸ್ತಿ ಇರ್ತದೆ, ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ ಜಾಸ್ತಿ ಇರ್ತದೆ. ಅದ್ರ ರಿಲೇಟೆಡ್ ಏನಾಗುತ್ತೆ ನಿಮಗೆ ಬಾಡಿಗೆ ಅಷ್ಟು ಅಮೌಂಟ್ಗೆ ಪ್ರೋಟೀನ್ ಸಿಗೋದಿಲ್ಲ, ಪ್ಲಸ್ ಬೋನ್ಗೆ ವೀಕ್ನೆಸ್ ಬರಲಿಕ್ಕೆ ಚಾನ್ಸ್ ಜಾಸ್ತಿ ಇದೆ. ಸೊ ಬೋನ್ ವೀಕ್ನೆಸ್ ಇದೆ ಅಂದರೆ ಆಬ್ವಿಯಸ್ಲಿ ಲೋಡ್ ಜಾಸ್ತಿ ಬಂದಿದೆ ಅಂದರೆ ಆಟೋಮೆಟಿಕಲಿ ಈ ಥರದ್ದು ಪ್ರಾಬ್ಲಮ್ ಏನೋ ಲೈಫ್ ಸ್ಟೈಲ್ ರಿಲೇಟೆಡ್ ಡಿಸಾರ್ಡರ್ಸ್, ನಾಟ್ ಓನ್ಲಿ ಆರ್ಥರೈಟಿಸ್, ಡಯಾಬಿಟಿಸ್, ಒಬೆಸಿಟಿ. ಈಗ ನೀವು ನೋಡಿದ್ರೆ ತುಂಬ ಜನಕ್ಕೆ ಹಾರ್ಟ್ ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಬರ್ತಾ ಉಂಟು. ಅದು ಎಲ್ಲ ಲೈಫ್ ಸ್ಟೈಲ್ ರಿಲೇಟೆಡ್ ಪ್ಲಸ್ ಫುಡ್ ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್ಸ್ಗೋಸ್ಕರ ಜಾಸ್ತಿ ಬರಲಿಕ್ಕೆ ಚಾನ್ಸ್ ಇದೆ. ಅದಕ್ಕೆ ಕರೆಕ್ಟ್ ನ್ಯೂಟ್ರಿಷನಲ್ ಸಪ್ಲಿಮೆಂಟ್ ಬೇಕು. ಎಲ್ಲ ಜನಕ್ಕೆ ಡೈಟಿಷಿಯನ್ ಆ ಥರ ಹೋಗ್ಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ, ಬಟ್ ನಾರ್ಮಲ್ ಹೋಮ್ ಫುಡ್ ಈಸ್ ಐ ವುಡ್ ಡೆಫಿನೆಟ್ಲಿ ಸಜೆಸ್ಟ್ ಈಸ್ ದ ಬೆಸ್ಟ್ ಆ್ಯಂಡ್ ಎನಿ ಒನ್ ಕ್ಯಾನ್ ಹ್ಯಾವ್ ಇಟ್. ಬಿಕಾಸ್ ಹೋಮ್ ಫುಡ್ ಎಲ್ಲ ಫ್ರೆಶ್ ಇರ್ತದೆ, ಪ್ರೊಸೆಸ್ಡ್ ಏನಿಲ್ಲ. ಸೊ ಆಟೋಮೆಟಿಕಲಿ ನಿಮಗೆ ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ ಮತ್ತೆ ಫ್ಯಾಟ್ ಕಂಟೆಂಟ್ ಜಾಸ್ತಿ ಸಿಗುದಿಲ್ಲ. ಸೊ ಆಟೋಮೆಟಿಕಲಿ ಒಬೆಸಿಟಿ ಕಮ್ಮಿ ಇರ್ತದೆ.
Is the stress a criteria for this body pain?
Definitely one of the criteria. ಯಾಕೆಂದ್ರೆ ಸ್ಟ್ರೆಸ್ ಜಾಸ್ತಿ ಬಂದಿದೆ ಅಂದರೆ ಮಸಲ್ ಟೈಟ್ನೆಸ್ ಜಾಸ್ತಿ ಬರ್ತದೆ. ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ ಯಂಗ್ ಏಜ್ಗೆ ನೀವು ನೋಡಿದೆ IT ಪ್ರೊಫೆಷನಲ್ಸ್ their work starts from 7:30-8 in the morning, goes on till 10-10:30 in the night. ಸೊ ಏನಾಗುತ್ತೆ ಕಂಟಿನ್ಯೂಸ್ಲಿ ಸಿಸ್ಟಮ್ ಮುಂದೆಗೆ ಕುತ್ಕೊಂಡು ಕೆಲಸ ಮಾಡ್ತಾರೆ ಅಂದರೆ ಸ್ಟ್ರೆಸ್ ಜಾಸ್ತಿ ಇರ್ತದೆ, ವರ್ಕ್ ಪ್ರೆಷರ್ ಜಾಸ್ತಿ ಇರ್ತದೆ. ಅದಕ್ಕೋಸ್ಕರ ಏನಾಗುತ್ತೆ ಇದು ಎಲ್ಲ ನೆಕ್ ಮತ್ತು ಶೋಲ್ಡರ್ ಮಸಲ್ ಸ್ಟಿಫ್ ಆಗುತ್ತೆ, ಬ್ಯಾಕ್ ಮಸಲ್ ಸ್ಟಿಫ್ ಆಗುತ್ತೆ, ಬ್ಯಾಕ್ ನೀ ಮಸಲ್ಸ್ ಮತ್ತು ಕಾಫ್ ಮಸಲ್ ಸ್ಟಿಫ್ ಆಗುತ್ತೆ. ಸೊ ಅದು ರಿಲೇಟೆಡ್ ಜಾಯಿಂಟ್ ಡ್ಯಾಮೇಜ್ ಬರಲಿಕ್ಕೆ ಚಾನ್ಸ್ ಇದೆ. ಸೊ ಸ್ಟ್ರೆಸ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಈಸ್ ಡೆಫಿನೆಟ್ಲಿ ಒನ್ ಆಫ್ ದ major concern, and it has to be managed properly because stress can lead to early arthritis or systemic problems like developing blood pressure, diabetes, all other things. So this definitely has to be considered when somebody is continuously working without getting breaks.
So before going to the solutions, let me ask any more causes associated with this?
More or less it is related to what we have discussed so far. Lifestyle, genetics, food habits, age related problems. Age related problems are basically considered as mechanical problems. Similarly, we can have problems like inflammatory arthritis or rheumatoid arthritis.
What is the difference, inflammatory arthritis and rheumatoid?
So basically inflammatory arthritis is a umbrella term. So in that there are 100 various types of condition which can affect the immune system. The way we have for breathing we have a breathing system, for blood circulation we have a circulatory system. Similarly, our body has a fighting spirit that is known as the immune system. ಏನಾಗುತ್ತೆ ಇನ್ಫ್ಲಮೇಟರಿ ಆರ್ಥರೈಟಿಸ್ ಅಲ್ಲಿ ಈ ಇಮ್ಯೂನ್ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಫಾಲ್ಟರ್ ಆಗುತ್ತೆ. ಸೊ ಬಾಡಿಗೆ ಕಾಣ್ತದೆ ಜಾಯಿಂಟ್ಸ್ ಬಾಡಿಗೆ ಪಾರ್ಟ್ ಇಲ್ಲ. ಸೊ ದ ಬಾಡಿ ಸ್ಟಾರ್ಟ್ಸ್ ಈಟಿಂಗ್ ಅಪ್ ದ ಜಾಯಿಂಟ್ಸ್ slowly. Rheumatoid arthritis is one of condition which comes under inflammatory and can affect the joints badly. So ಅದರಲ್ಲಿ ಬೇರೆ ಥರದ್ದು ಕಂಡೀಷನ್ ಇದೆ, ಸಿರೋ ಪಾಸಿಟಿವ್, ಸಿರೋ ನೆಗೆಟಿವ್. ಸೊ ವೇರಿಯಸ್ ಕಂಡೀಷನ್ಸ್ ಇರ್ತದೆ. ಅದಕ್ಕೆ ಪೆರಿಫೆರಲ್ ಜಾಯಿಂಟ್ಸ್ ಅಂದರೆ ಫಿಂಗರ್ಸ್ ಮತ್ತು ಫೀಟ್ಗೆ ಅಫೆಕ್ಟ್ ಆಗುತ್ತೆ ಪ್ರೈಮರ್ಲಿ. ಬಟ್ ಅದು ಕರೆಕ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡಿಲ್ಲ ಅಂದರೆ ಹಿಪ್ ಜಾಯಿಂಟ್, ನೀ ಜಾಯಿಂಟ್ ಅಫೆಕ್ಟ್ ಆಗುತ್ತೆ. ಆ ಥರ ಅದು ಆಂಕಿಲೋಸಿಂಗ್ ಸ್ಪಾಂಡಿಲೈಟಿಸ್ ಥರದ್ದು ಕಂಡೀಷನ್ ಇದೆ, ಅದಕ್ಕೆ ಸ್ಪೈನ್ ಅಫೆಕ್ಟ್ ಆಗುತ್ತೆ. ಸೊ ಆ ಥರದ್ದು ವೇರಿಯಸ್ ಕಂಡೀಷನ್ ಇರ್ತದೆ. ಏನು ನೀವು ಯು ವುಡ್ ಹ್ಯಾವ್ ಹರ್ಡ್ ಅಬೌಟ್ ಗೌಟ್ ರಿಲೇಟೆಡ್ ಕಂಡೀಷನ್ಸ್. ಓಕೆ, those kind of things, all those things comes in inflammatory arthritis. Those are also can lead to joint damage. So when somebody is having aches and pains in multiple joints, it is an indication probably they might be having ಈ ಥರದ್ದು ಸಂಧಿವಾತ ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್ಸ್. ಸೊ ವೆನ್ ದಟ್ ಹ್ಯಾಪನ್ಸ್ ಇಟ್ ಈಸ್ ಆಲ್ವೇಸ್ ಬೆಟರ್ ಟು ಸಿ ಎ ಸ್ಪೆಷಲಿಸ್ಟ್. ಈಗ ಸಂಧಿವಾತಕ್ಕೆ ಬೇರೆ ಸ್ಪೆಷಲಿಸ್ಟ್ ಬಂದಿದೆ. ಸೊ ಟು ಸಿ ಎ ಸ್ಪೆಷಲಿಸ್ಟ್ ಆ್ಯಂಡ್ ಗೆಟ್ ಇಟ್ ಟ್ರೀಟೆಡ್ ಪ್ರಾಪರ್ಲಿ. ಆ ಥರದ್ದು ಕಂಡೀಷನ್ ಕರೆಕ್ಟ್ ಡಯಾಗ್ನೋಸ್ ಆಗಿದೆ ಅಂದರೆ ಅಬ್ಸಲ್ಯೂಟ್ಲಿ 100% ಇದು ಮ್ಯಾನೇಜ್ ಮಾಡಲಿಕ್ಕೆ ಆಗುತ್ತೆ. ಇಟ್ ಈಸ್ ಲೈಕ್ ಹ್ಯಾವಿಂಗ್ ಡಯಾಬಿಟಿಸ್ ಆರ್ ಬ್ಲಡ್ ಪ್ರೆಷರ್. ಒನ್ಸ್ ಯು ಹ್ಯಾವ್ ಇಟ್, you have to be under medication for whole life. But when you are on medication ಬೇರೆ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇರೋದಿಲ್ಲ. ಸೊ ಆ ಥರದ್ದು ಸಂಧಿವಾತ ಪ್ರಾಬ್ಲಮ್ ಆಗಿದೆ ಅಂದರೆ ಕರೆಕ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡಿದೆ ಅಂದರೆ ಈ ಥರದ್ದು ಕಂಡೀಷನ್ಗೆ ಕಂಪ್ಲೀಟ್ಲಿ ಕಂಟ್ರೋಲ್ ಮಾಡಲಿಕ್ಕೆ ಆಗುತ್ತೆ.
Okay. So can I ask if the numbness of the fingers, is it related to the arthritis or is it a symptom?
Yes, numbness related to fingers are primarily because of nerve compression. So that is purely related to spine. So ಒಂದು ರೀಸನ್ ಸ್ಪೈನ್ಗೆ ನರ್ವ್ ಅಲ್ಲಿ ಪ್ರೆಷರ್ ಜಾಸ್ತಿ ಇದೆ ಅಂದರೆ ಫಿಂಗರ್ ಅಥವಾ ಹೋಲ್ ಕಾಲ್ಗೆ ಟಿಂಗ್ಲಿಂಗ್ ಥರದ್ದು ಸೆನ್ಸೇಷನ್ ಬರ್ತದೆ, ನಮ್ನೆಸ್ ಬರ್ತದೆ. ಅದು ಒಂದು ರೀಸನ್. ಸೆಕೆಂಡ್ ಕಾಮನ್ ರೀಸನ್ ಅಂದರೆ ಡಯಾಬಿಟಿಸ್. ಯು ವುಡ್ ಹ್ಯಾವ್ ಹರ್ಡ್ ಆಫ್ ದಿಸ್ ಕಂಡೀಷನ್ ಕಾಲ್ಡ್ ಡಯಾಬಿಟಿಕ್ ನ್ಯೂರೋಪತಿ. ಸೊ what happens because of the diabetes, the small nerve endings do not get proper sensation or proper firing. So adugoskara kaal ಮತ್ತೆ ಫೀಟ್ಗೆ ಸೆನ್ಸೇಷನ್ ಕಂಪ್ಲೀಟ್ ಇರುವುದಿಲ್ಲ. ಸೊ these are the two common conditions which leads to tingling sensation. ಥರ್ಡ್ ಅಂದರೆ ಈಗ ಮೇಜರ್ ಕನ್ಸರ್ನ್ ಅಂದರೆ ಬ್ಯಾಡ್ ಪೋಸ್ಚರ್ ರಿಲೇಟೆಡ್ ನರ್ವ್ ಪ್ರೆಷರ್. ಅದು ಸ್ಪೈನ್ಗೆ ಪ್ರೆಷರ್ ಇರುವುದಿಲ್ಲ, ಬಟ್ ಡಿಫ್ರೆಂಟ್ ಪೆರಿಫೆರಲ್ ಲೆವೆಲಲ್ಲಿ ಪ್ರೆಷರ್ ಇರುತ್ತದೆ. ಪ್ರೆಷರ್ ಅಂದರೆ ಬಟಕ್ ಲೆವೆಲಲ್ಲಿ ತುಂಬ ಕಂಟಿನ್ಯೂಸ್ಲಿ 8 to 10 hours ಕೂತ್ಕೊಂಡೆ ಅಂದರೆ ಬಟಕ್ ಮಸಲ್ಸ್ ಒಳಗಡೆ ಒಂದು ನರ್ವ್ ಹೋಗ್ತದೆ, ಅದಕ್ಕೆ ಹೇಳ್ತಾರೆ ಸಯಾಟಿಕ್ ನರ್ವ್. ಅದಕ್ಕೆ ಪ್ರೆಷರ್ ಬಂದಿದೆ ಅಂದರೆ ಟಿಂಗ್ಲಿಂಗ್ ಸೆನ್ಸೇಷನ್ ಬರಲಿಕ್ಕೆ ಚಾನ್ಸ್ ಇದೆ. ಸೊ ಇದು ಪ್ರೆಷರ್ ರಿಲೇಟೆಡ್ ಟು ಪೋಸ್ಚರ್ ಇದೆ ಅಂದರೆ ಅದು ಎಕ್ಸಸೈಸ್, ಪ್ರಾಪರ್ ಸ್ಟ್ರೆಚಿಂಗ್, ಪ್ರಾಪರ್ ಫಿಟ್ನೆಸ್, ಲೈಫ್ ಸ್ಟೈಲ್ ಮಾಡಿಫಿಕೇಶನಲ್ಲಿ ಕರೆಕ್ಟ್ ಟ್ರೀಟ್ ಮಾಡಲಿಕ್ಕೆ ಆಗುತ್ತೆ. ಇಫ್ ಇಟ್ ಇಸ್ ರಿಲೇಟೆಡ್ ಟು ಸ್ಪೈನ್ ಕಂಪ್ರೆಷನ್, with proper spine evolution we can modify, by modifying your lifestyle and exercises. With certain medications it can be cured. At times obviously it requires surgical intervention which a specialist can advise better on. If it is related to peripheral neuropathy related to diabetes, these are the conditions difficult to cure. But with proper maintenance and treating your diabetes up to a major extent ಅದು ಮ್ಯಾನೇಜ್ ಮಾಡಲಿಕ್ಕೆ ಆಗುತ್ತೆ. ಬಿಕಾಸ್ ಪೆರಿಫೆರಲ್ ನ್ಯೂರೋಪತಿಯಲ್ಲಿ ಈಗ ತನಕ ಏನು ಕರೆಕ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಅವೈಲೇಬಲ್ ಇಲ್ಲ. ಸೊ ಡಯಾಬಿಟಿಸ್ ಕಂಟ್ರೋಲ್ ಮಾಡಿದೆ, ಕರೆಕ್ಟ್ ಫುಟ್ವೇರ್. ತುಂಬ ಜನ ಫುಟ್ವೇರ್ ಅಲ್ಲಿ ಫೋಕಸ್ ಮಾಡೋದಿಲ್ಲ. ಕರೆಕ್ಟ್ ಫುಟ್ವೇರ್ ಹೇಳ್ತಾರೆ ಅಂದರೆ, ಸರ್ ನನ್ನ ಹತ್ರ ಪೂಮಾ ಅಥವಾ ಅದಿದಾಸು ಒಂದು 10,000 rupeesದು ಫುಟ್ವೇರ್ ಇದೆ. ಇಟ್ಸ್ ನಾಟ್ ಅಬೌಟ್ ಹೌ ಎಕ್ಸ್ಪೆನ್ಸಿವ್ ಇಟ್ ಈಸ್. ಎಲ್ಲ ಜನಕ್ಕೆ ಫುಟ್ ಸ್ಟ್ರಕ್ಚರ್ ಡಿಫ್ರೆಂಟ್, ಆರ್ಚ್ ಸ್ಟ್ರಕ್ಚರ್ ಡಿಫ್ರೆಂಟ್. ಸೊ ಅದು ಎಕ್ಸಾಕ್ಟ್ಲಿ ಫ್ಲಾಟ್ ಫುಟ್ ಅದು ಒಂದು ಜೆನೆಟಿಕ್ ಫ್ಯಾಕ್ಟರ್ ದಟ್ ಆಲ್ಸೋ ಲೀಡ್ಸ್ ಟು ಅರ್ಲಿ ಆರ್ಥರೈಟಿಸ್. ಒಂದು ಜನಕ್ಕೆ ಹೈ ಆರ್ಚ್ ಇರ್ತದೆ, ಫ್ಲಾಟ್ ಫುಟ್ ಅಂದರೆ ಈ ಥರದ್ದು, ಹೈ ಆರ್ಚ್ ಅಂದರೆ ಈ ಥರದ್ದು. ಸೊ ಅದರ ರಿಲೇಟೆಡ್ ಪ್ರಾಪರ್ ಆರ್ಚ್ ಸಪೋರ್ಟ್ ಸಿಗ್ತದೆ. ಈಗ ನಿಮಗೆ ಬೇಸಿಕ್ ಆರ್ಚ್ ಸಪೋರ್ಟ್ ಯಾವುದು ಫುಟ್ವೇರ್ ಸ್ಟೋರಲ್ಲಿ ಸಿಗ್ತದೆ. There are something called customized arch support also. So what we do is we measure their arch with different machines available nowadays, and on that basis we can modify their arch support which can be used as insole in the shoe. So what it does is it maintains your natural arch. So that abnormal pressure related to the ankle or to the knee or to the joints above can be reduced.
Okay.
And that's how we can, you know, prevent arthritis before it becomes obvious.
Okay. So when you said that, sir, like some people have that temptation of falling, tripping.
Yes,
So
yes.
when they walk, so what could be the reason for that?
So that is the one of the common reason is high flexibility
Okay.
or joint imbalance. That is something which can be treated pretty much just by good amount of exercises. When I tell about exercises, it's not about going to the gym or doing basic exercises.
Okay.
That is where I am pursuing my PhD. It is finding the joint imbalance.
Okay.
So for example, when you close your eyes, still you can make out where is your hand or where is your feet.
Yes.
How? Because ಎಲ್ಲ ಜಾಯಿಂಟ್ಗೆ ಸೆನ್ಸರ್ಸ್ ಇರ್ತದೆ. ಅದು ಹೇಳ್ತಾರೆ ಪ್ರೊಪ್ರಿಯೋಸೆಪ್ಟಿವ್ ಸೆನ್ಸರ್ಸ್
Okay.
ಆರ್ ಪ್ರೊಪ್ರಿಯೋಸೆಪ್ಟರ್ಸ್. ಅದು ಬೇಸಿಕಲಿ ಅವ್ರ ಫಂಕ್ಷನ್ ಏನು, when we are not getting any visual feedback, these are the sensors continuously gives feedback to the brain how your joint is positioned.
Okay.
Okay, that is called sense of joint positioning. So ಅದರಲ್ಲಿ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಆಗಿದೆ ಅಂದರೆ ಟ್ರಿಪ್ ಆ್ಯಂಡ್ ಫಾಲ್ ಆಗಲಿಕ್ಕೆ ಚಾನ್ಸ್ ಜಾಸ್ತಿ ಇದೆ.
Okay.
ಆ್ಯಂಡ್ ದಟ್ ಈಸ್ ವೇರ್ ಮೆಜಾರಿಟಿ ಆಫ್ ಅವರ್ ಯಂಗ್ಸ್ಟರ್ಸ್ ಆರ್ ಆ್ಯಕ್ಚುಲಿ ಸಫರಿಂಗ್.
Okay.
ಸೊ ಅದಕ್ಕೆ ನಾವು ವಿ ಹ್ಯಾವ್ ಟೆಕ್ನಾಲಜಿ, ವಿ ಹ್ಯಾವ್ ಎ ಸೆಂಟರ್ ಅಟ್ KMC and we have developed certain devices where we can check your posture by standing on the device, you know, with open eyes, closed eyes, and we can check certain angles when you move. So that gives us idea whether your body balance is good or no.
Good one.
Because the first indication of arthritis is lack of body balance.
Okay.
So now we have facilities where we can predict whether you are going to have arthritis or no.
Okay.
And we can treat it before it becomes obvious in radiological investigation. Andre X-ray, MRI finding, before the X-ray and MRI changes happen, we can diagnose it just by checking your body balance.
Okay.
So that we are continuously working on. We have got a setup at KMC Hospital, Ambedkar Circle, and here at GATI, Gait and Posture also, we are working on such devices, and we are going to install our device in probably in next few months.
Oh, okay. Oh, that is the work. That is the topic you are actually working
Absolutely,
on.
absolutely,
Gait
madam.
analysis. Okay.
ಯಾಕಂದ್ರೆ early arthritis, if we can prevent, it can be great service to the society. ಯಾಕಂದ್ರೆ currently ಇಂಡಿಯಾದಲ್ಲಿ more than 30% people are suffering with arthritis.
Okay.
30% out of 1.5 billion is a huge number.
Definitely.
And out of that, 70% if we can diagnose early, actually you can prevent them going to a replacement surgery.
Okay.
And all those things can be done just by exercises.
Okay.
So adike early detection is the key.
Okay.
And with developing technology, now we are in a position where we can detect it before it becomes obvious in an X-ray and MRI.
Okay.
So that's why we are continuously working on this device, and we are doing a lot of collaboration with NITK as well, with the engineers at
Okay.
NITK.
You're going to make a patent out of it.
We have already got one patent, and we are in the process of
that's
developing another patent, and we are in the process of getting government funds for this research work as well, madam.
Okay. Okay. So may I know what instrument is there?
This is basically gait analysis ಅಂದ್ರೆ ಒಂದು ಹ್ಯೂಜ್ ಡಿವೈಸ್. ಅದಕ್ಕೆ ಇಂಡಿಯಾದಲ್ಲಿ ಗೇಟ್ ಅನಾಲಿಸಿಸ್ ಡಿವೈಸ್ ಇದೆ, ಬಟ್ ದೋಸ್ ಡಿವೈಸಸ್ ಆರ್ ವೆರಿ ಎಕ್ಸ್ಪೆನ್ಸಿವ್, ನೀಡ್ಸ್ ಎ ಸೊಫಿಸ್ಟಿಕೇಟೆಡ್ ಲ್ಯಾಬ್ರೋಟರಿ, ಆ್ಯಂಡ್ ಇಟ್ ನೀಡ್ಸ್ ಟು have sensors putting in the skin in different joints.
Okay. Okay.
With our culture, for example, a 60-year-old amma, they come to clinic or come to hospital with sari.
Yeah.
So avrike skin sensor ಹಾಕ್ಲಿಕ್ಕೆ ಸ್ವಲ್ಪ ಡಿಫಿಕಲ್ಟ್. ಯಾಕಂದ್ರೆ you have to have tight fitting clothes,
Yeah.
you have to have sophisticated laboratory, you have to have technology which needs have those type of setups. And what happens, adu because of the cost factor and limited access to the public, it is difficult for our senior citizens to access that sort of setup
Yeah.
and get a proper evaluation. ಅದಕ್ಕೆ we are developing devices which can be used in normal OPD setup without having those skin sensors. And we want to get results or get interpretation which can be easily interpreted by the orthopedic surgeon or a physiotherapist.
Okay. Without undergoing MRI or
ಎಕ್ಸಾಕ್ಟ್ಲಿ ಯಾಕಂದ್ರೆ ಅರ್ಲಿ ಮಸಲ್ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಗೊತ್ತಾಗಿದೆ ಅಂದ್ರೆ ಹೇಗೆ ನಿಮ್ದು ಫುಟ್ ಪ್ರೆಷರ್ ಚೇಂಜ್ ಆಗ್ತಾ ಉಂಟು ನಡೆಯುವಾಗ ಅದು ಗೊತ್ತಾಗಿದೆ ಅಂದ್ರೆ we can pretty much detect the problem before it comes. So that is something where we are continuously working, and we are probably, as I told you, we are going to have that setup here in GATI Gate and Posture and at KMC. In fact, we have got a primary version of that already installed at KMC and another prototype already functional at NITK, and here we are getting the latest version. So ಅದರಲ್ಲಿ ಏನಾಗುತ್ತೆ, it can be done in small setups. It can be done for majority of our population. It can be done
short span time.
Exactly, time save ಆಗುತ್ತೆ. Plus main ಅಂದ್ರೆ
economic.
Exactly. So it is economically beneficial for the patients. So that is something which already a lot of work is going on, and hopefully that is the way out from these expensive setups and all these things which are limiting our treatment to majority of our population.
So now present treatment costs how much, like?
So if it is related to early arthritis, we can pretty much manage with exercises, which obviously doesn't cost much. You can have a comprehensive assessment and interval follow-up so that we can step up with our exercise program, and that can be done by specialist physiotherapist or a specialist lower limb specialist. That obviously doesn't cost much and it is very economical. There are various treatment options available for early to moderate amount of arthritis, where various treatments like injection therapy or different sort of interventions are available. If it comes to arthritis at a later stage, obviously a replacement option is available. Nowadays we have something called partial replacement that is also done in terms of when people are suffering with joint arthritis, but the whole joint is not affected, only part of the joint is affected, so you can replace the
that
part of the joint.
All
those things, there are different hospitals offering different services. We at KMC Hospital have a specialist center for hip and knee that is run by Dr. Yogesh Kamath. So he obviously can give you better idea in terms of the expenditure, but definitely these are something which can be managed without having much of economical burden. Of course, if it is diagnosed early, will be ideal, because that can be managed without any expenditure, if at all, if I have to put it in that way.
So how do you collaborate with the orthopedic surgeon, like say, Yogesh sir?
Yes. So it is a what we call as a jugalbandi. So he does the later part of the treatment, later part as in when the arthritis has advanced or sports injury where surgical intervention is required. As a specialist, he tries his level best to give the best possible joint or surgical intervention to the patient. Similarly, as I told you, half of our OPD is filled with young people with early arthritis. So that is the category where I obviously try to manage that with exercise therapy, with proper balance development and with proper gait
and training.
So that is done before surgery, that is people with young arthritis or having genetic elements, and the same can be done after joint replacement as well, because that plays a major role to improve the quality of life. So when it comes to exercise, obviously I, as a specialist in exercise,
Yeah.
I take over. And when it comes to patients where the disease has advanced to a certain stage where it cannot be managed with exercises, obviously he further advises on what to do, when to do, and how it can be managed.
Okay.
So that's why we try to manage with a collab, because one without the other is incomplete. And until unless certain awareness is not created, it is difficult for a physiotherapist to manage on its own.
Yeah.
Whereas the orthopedic surgeon, as a specialist, he can advise on the importance of exercises.
Yeah.
And where we can manage without surgery. So that's how we try to collab and work together.
Okay. So now, like you said, like many of the youngsters are facing this problem. Like in Mangalore, can I ask you, like, ಎಷ್ಟು percentage of youngsters ಬರ್ತಾರೆ asking for this? Yeah.
See, as a specialist low limb center, average OPD out of, for example, if we see around 100 patients a day, at least 30% of them are actually young people.
Okay.
So that's a huge
20
number.
to 30 you're saying?
Absolutely. In fact, nowadays we are seeing a lot of people below 20 as well. Early school going kids with bad posture. Okay. Young people into IT profession or banking or teaching profession.
Yes.
Where they have to stand a lot.
Yeah.
And people with little on the heavier side, with obesity are coming to OPD with early neck pain, back pain, knee pain, lot of various foot related conditions and other conditions.
Okay.
So definitely we are looking at a major chunk, at least 1/3 of our OPD is filled with young people, which is not good. And this is the portion which we can definitely manage just with exercises, I feel.
Okay. So what are the remedies you prescribe?
Yes. So the first remedy is definitely lifestyle modification. The natural treatment is the best treatment.
Yeah.
Lifestyle doesn't mean just going to the gym.
Yes.
Lifestyle means having a healthy diet, good exercise program, managing regular fitness, and stress.
Yeah.
That is one of the major part of the treatment procedure.
Okay.
When I talk about fitness, it combines of a regular amount of stretches, strengthening the weaker muscles, reducing or managing your body weight, and maintaining it. Now in Mangalore we have options like, there are a lot of athletic options are available.
Yes.
Like cycling, swimming. We have got good facilities for running.
Yes.
We have got stadiums. So that can be used. Okay. So that basically protects your joint. That is the primary treatment.
Okay.
Second is diagnosing the problem at earliest. So do not neglect if you have one injury, because majority of the time neglected injury leads to arthritis.
Yes.
So ಸ್ಪೋರ್ಟ್ಸ್ ಇಂಜುರಿ ಆಗಿದೆ ಅಂದರೆ ಕರೆಕ್ಟ್ ಸ್ಪೆಷಲಿಸ್ಟ್ ಅಲ್ಲಿ ತೋರಿಸ್ಬೇಕು. ಸೊ ಅರ್ಲಿ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಡಯಾಗ್ನೋಸ್ ಆಗಿದೆ ಅಂದರೆ ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಮ್ಯಾನೇಜ್ಡ್ ವಿತ್ ಎಕ್ಸರ್ಸೈಸಸ್ ಇನ್ ಕಾಂಬಿನೇಷನ್ ವಿತ್ ಕೀಹೋಲ್ ಸರ್ಜರಿ ಆಸ್ ಅನ್ ವೆನ್ ಇಟ್ ಈಸ್ ರಿಕ್ವೈರ್ಡ್. ಕೀಹೋಲ್ ಸರ್ಜರಿಗೆ ತುಂಬ ಈಸಿ ಆಗಿದೆ, ಅದಕ್ಕೆ ರಿಕವರಿ ತುಂಬ ಫಾಸ್ಟ್ ಆಗಿದೆ. ವಿತ್ ACL ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಆರ್ ಸ್ಪೋರ್ಟ್ಸ್ ಇಂಜುರಿ ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಬೆಳಿಗ್ಗೆ ಸರ್ಜರಿ ಮಾಡಿದೆ ಅಂದರೆ ಮಧ್ಯಾಹ್ನ ತನಕ ನಡಿಲಿಕ್ಕೆ ಆಗತ್ತೆ. ವಿದಿನ್ 8 to 9 months go back to sports is also possible. So that obviously has to be done with graded amount of rehabilitation. So neglect ಮಾಡಬೇಡಿ. ಥರ್ಡ್ ಅಂದರೆ ಅರ್ಲಿ ಆರ್ಥರೈಟಿಸಲ್ಲಿ ಈಗ ವೇರಿಯಸ್ ಫಾರ್ಮಾಸ್ಯೂಟಿಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆ, ವೇರಿಯಸ್ ಜಾಯಿಂಟ್ ಲುಬ್ರಿಕೇಶನ್ ಟ್ಯಾಬ್ಲೆಟ್ಸ್
Okay, medications, just with the medications.
Yes, but medication combined with exercises. Only medication do not help.
Okay.
And self medications are definitely not good.
Not good. Okay.
Those things has to be prescribed and monitored by a specialist.
Experts. Okay.
Purchasing off the counter medication and taking it continuously can lead to early damage in various systems.
Okay.
So adike definitely no self medication is advisable.
Okay. Okay.
Further treatment andre various injection therapy or stem cell therapy that has to be done by a specialist after proper evaluation and grading of your problem.
Okay.
It shouldn't be done just like that.
Okay.
Next treatment option andre joint replacement. Joint replacement partials ಈಗ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತದೆ, ಕಂಪ್ಲೀಟ್ ಜಾಯಿಂಟ್ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಆರ್ ಟೋಟಲ್ ಜಾಯಿಂಟ್ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತದೆ. ಬಟ್ ದ್ಯಾಟ್ ಅಗೇನ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಡನ್ ಬೈ ಎ ಸ್ಪೆಷಲಿಸ್ಟ್ ಸೊ ದ್ಯಾಟ್ you get maximum out of the surgical intervention or the pharmaceutical management.
Okay.
All those things has to be combined with good amount of rehabilitation where the patient has to get educated because their effort has to be maximum.
Okay. Yes.
Exercises doesn't mean that with certain exercises what was told to you on the first visit has to be done continuously. Depending upon your recovery it has to be changed. For example, with sports reconstruction surgery we have 5 phased rehabilitation. So every phase is different from the other. And depending upon how you are recovering a specialist can modify your exercise program and take you to the next stage. Same happens with joint replacement also. Nowadays with proper amount of rehabilitation and with proper treatment in our center we have got almost 90 to 95% of athletes going back to international sports as well. Whereas patients with joint replacement have gone back to doing cross-legged sitting, that is chakra vakra, kneeling down in the temple. Because in India our treatment or our health is deeply associated with our spiritual belief. So those sort of activities are absolutely possible, but it has to be monitored and supervised by a specialist. So do not experiment on various things, particularly with the artificial joint. We want to strain the joint and end up with more complications.
Okay, first thing is to convince them, especially they are the youngsters in between 20 to 30.
Yes.
So how do you convince them?
See,
I know you are amazingly skilled in this, but still when it comes to the youngsters it is
see, the convincing starts with self education. Okay. When you know your body you obviously get convinced what treatment you require, whether, and obviously nobody prefers to have a surgery at first go. So conservative treatment can be done where you do not have to come to the hospital again and again or you have to stay in hospital for your treatment. So the first and the most difficult part is to educate. Of course that is where a lot of our time goes, but we feel educating the patient is basically treating the problem up to 50%. So educating them about their joint and what they can do in terms of lifestyle to prevent their joint from getting worse. So that is basically the convincing. When it comes to having a real problem like where the joint needs surgery, that has to be explained to them with all the pros and cons. When you give them clarity, obviously it is much easier to convince. But of course that has to be done with proper evaluation and then making a proper plan. So that has to be done in a center where the facilities are better and where the recovery rate is as comparable to the best standards in the world. So then it becomes easier to convince the patient.
And when it comes to the lower back pain and back pain in general, So how exactly it happens?
Yeah. So primarily back pain is related to bad posture, bad sitting habits,
Okay.
obesity, and not taking care of your posture properly. These are the primary causes. Secondary is arthritis, which can happen because of age.
Okay.
Certain injuries or trauma can lead to it. When it is at an earlier stage, with proper lifestyle modification and certain stretches with strengthening the core and back muscle, we can manage it. There are times where there is more pressure over the nerve due to various conditions like disc prolapse or age related arthritis, or various conditions where there is change happened in the spinous in the vertebra, that is the spine bone. That has to be evaluated with proper X-ray and MRI and a comprehensive evaluation by a spine specialist.
Okay.
So majority of the time this sort of conditions, if it is detected early, can be managed without surgery.
Okay. And the slip disc condition, do you take any give any treatment for this condition?
Yes. Slip disc is basically when your disc, which is a pulpy material or a soft material, has come out of its original place. It goes and compresses the nerve, where the nerve can be very painful and you can have tingling sensation. Those sort of things, if it is minor problem, can be managed with initially rest, with avoiding certain activities like lifting heavy weights. And this most often happens with youngster hitting the gym, thinking that within 1 month they have to come up with a bulky body with 6 packs. So those sort of things are actually better to avoid. This is the fad of having a 6-pack in a certain period of time and taking various different supplements to make the body look like a Hulk can lead to problem. So these sort of problems has to be first of all diagnosed properly, and then treated. The treatment essentially a combination of medications, rest and exercises. Of course, avoiding certain habits makes it easier for the patient to recover, but definitely can be managed up to, if it is not severely compressed, up to 100% can be managed with good amount of exercises.
So you give treatment for such conditions also.
This is part of sports injury where we deal this type of patients regularly.
Okay. So now, as you said, gym people, so they are taking extra struggles to gain their body. So what do you suggest?
See, having a proper trainer and proper diet plan obviously helps. And the expectation of getting 6 packs in a limited period of time.
Do you think such struggle is necessary?
I do not feel that is necessary. Particularly if you want to have healthy back or healthy joints, I definitely suggest you not to experiment on your body. But gym is something I definitely recommend almost all my patients, because that is something where we can develop our body. We can develop certain muscles which can be easily managed with various equipments, whereas physically doing that becomes little more challenging. So gym is definitely good, but not unsupervised, and definitely not on having supplements which exactly. So those sort of supplements, various protein supplements or steroid supplements, if it is unsupervised, can lead to more complications rather than giving benefits. So those sort of things I definitely suggest you to avoid.
So now, sir, when I said lower back pain or back pain, so there is a therapy called cup therapy.
Yes.
So is it good?
See, there are various alternative therapies, cupping therapy, or you would have heard of these things called acupuncture, dry needling.
Does it come under physiotherapy or?
Yes, it is part of the physiotherapy treatment, where we do offer at our center also those sort of things, but again, as I told you, these sort of things always better if it is supervised and done properly, because we don't want to cause further problem. So when it is supervised, then obviously it is beneficial. When it there are a lot of youngsters try to experiment and do certain things which sometimes can lead to more problem. So definitely those sort of things are beneficial, but again, it has to be taken with precaution and has to be supervised properly.
So sometimes what happens is like a minor slip also brings this ligament tear or bone fracture.
Yes.
So actually, what is the phenomenon happening, sir?
Yes.
Can you just
ligament is basically a structure. It's a part of tendinous process. Basically joints from bone to bone. So for example, you can see in this joint, this is the thigh bone, this is the leg bone, and you can see the various structure. This is called ACL. So basically the function of the ligament is to give control to the joint. So it allows certain movement in a controlled fashion. What happens with sports injury? This is the commonest injury which happens and gets cut.
ACL.
This is called ACL, and these are called the cushion of the knee joint, called the meniscus, the side. So what happens with certain sports injury with twist, this can get rupture or this meniscus can get torn. So this has to be treated properly. Once a ligament is gone, it is gone. It cannot regenerate on its own. So if somebody who is into sports or into fitness and definitely below 40, it is recommended to reconstruct this ligament or repair this meniscus or partly take it out if it is not repairable. These sort of problems, if it is detected early, can be managed without having further damage to the joint. When this sort of things gets neglected, this bone surface, which has to be smooth, can get more pressure and can lead to arthritis. Arthritis is basically irreversible, whereas ligament injury or meniscus injury, we can treat it with keyhole and you can have 100% functionality.
So reconstruction means how is the reconstruction happening? Like, is it natural? It cannot happen.
No. Once the ligament is gone, it is gone. There are various ligaments which can can repair on its own. For example, these side ligaments. These sort of ligaments, if it is up to grade 2, that is up to 60 to 70%, it can heal on its own. Whereas this ligament, once it is gone, it is gone. Because knee joint doesn't have natural blood supply within. It has lot blood supply from outside. So for any living tissue to heal, we need to have natural blood supply, because that is where the nutritional supplement comes. So once it is gone, it cannot regenerate. So with a keyhole, a surgeon makes a new ligament by taking part of your muscle from a thigh, from your back of thigh or from the from leg, from various places, ligament or tendon can be taken and it can be reconstructed. So these are the things can protect the joint from getting further damage, madam.
So, sir, which other physiotherapy sessions you take?
I, as a specialist, I deal with particularly sports injury, sports injury related to joints, knee, hip, back or shoulder. I treat patients with various spinal conditions like low back ache or spinal nerve compression or arthritis in the spine, and of course part of my major work is related to sports injury related reconstruction surgery and joint replacement rehabilitation, and majority of them can be managed with staged rehabilitation along with gait training. So making their walking better can definitely help them to get that quality of life back.
And about the muscle cramp, what exactly it is?
Yes.
Muscle cramp.
Muscle cramp is basically it's a condition where the muscle is continuously firing without having any break or relaxation. One of the prime cause of muscle cramp is dehydration. Okay, when your body is not completely hydrated, you can have cramps. So cramps are basically muscles when they continuously work, they release lactic acid, which is basically toxic substance for the muscle. That's why they release it.
Yes.
When your body is nutrited, that gets balanced properly. When you are dehydrated and your lactic acid production is more, basically you get cramps.
Okay.
This can happen because of bad posture as well. Tight muscles are also one of the major cause of that. Another reason is hormonal changes, particularly ladies during their monthly cycles do get this sort of cramps. Common cramps are related to the back and calf muscles. You would have heard of this night cramps.
Night cramps, yeah.
That is primarily.
We have felt.
Yes, madam. All of us have gone through it.
Yeah.
It's primarily because of dehydration, bad posture. So that's why it is always better to have a regular exercise program to stretch the tight muscle and strengthen the weaker muscle along with proper hydration to your body.
Okay.
The best hydration is not buying fancy drinks.
Okay.
Natural bonda water is more than sufficient. You can have lime juice or anything with more citric acid can help to get rid of this problem.
Okay. So now when it comes to the pain, so doctors usually prescribe cushioning hot water. So why exactly it is?
Yeah, see there are various therapies available. One, you would have heard of hot water fermentation. There are few people who prefer cold water fermentation. When it is an acute muscle injury, usually we advise cold so that the acute inflammation in the joint or swelling in the joint can reduce with cold therapy. Whereas hot water fermentation is basically for a chronic problem like chronic neck pain, back pain or knee pain where the muscle has become a little tighter. So hot water fermentation basically releases the muscle and it reduces the muscle spasm. Acute neck spasm or back spasm which happens most of the time because of continuously sitting in front of the system, those sort of things has to be managed with hot water bag. Whereas with injury or swelling in the joint has to be managed with cold water.
Ice or cold water.
Exactly. So both these things work on various principles to reduce the spasm or to reduce the swelling and inflammation.
Also sir, now there is one term called tennis elbow.
Yes.
My mother had it actually.
Correct.
Why it is called tennis elbow? Is it because it is mainly seen in athletic people? Sports people?
It is because it is called tennis elbow doesn't mean it happens to the athlete. It is called tennis elbow because the elbow, there are various group of muscles. For example, if I have to make a fist, I have certain group of muscles working. Whereas if I have to drive or accelerate, the other group of muscles are working. So when one certain group of muscles are at the insertion level, at the origin level, at the elbow is getting pulled, that is basically called the tennis elbow or what we call as epicondylitis. There is a medial, there is medial epicondylitis and there is lateral epicondylitis. So one is called tennis elbow, one is called golfer's elbow. It mainly happens when there is strain over the elbow joint. Tennis is one of the sports where it affects more, so that's why it has got a name. But it can happen to anyone. Particularly it happens to people who are continuously working in system.
Then how did my mother?
And happens to people who are housemakers because doing kitchen activities, doing certain curries or lifting of things, squeezing cloth, any rotation activity in the elbow can lead to this type of problems.
Okay.
Not necessarily it affects only the sports people or athletes.
Okay.
It majority of the time it affects to laymen who are doing basic household work or working with the systems.
Okay.
So it can affect to anyone. These kind of things can be 90% of the time managed with proper rest, with icing to the joint and developing muscle strength around the elbow joint.
Okay.
And of course avoiding certain positions, particularly rotation in the elbow.
Okay.
Lot of time you see our mothers do grinding continuously, keeping one hand over the grinder and getting certain vibration. That also can affect.
Yes.
Squeezing the cloth.
Squeezing the clothes.
Exactly.
Blankets.
Lifting up pressure cooker or the kadai and all.
Kadai,
Those things can affect. So that's why it is again comes back to having proper posture and avoiding certain things.
Okay. When a particular person should consult a doctor?
As earliest as possible, definitely. When you are having aches and pains which is not settling down with rest, with basic exercises, it is always better to see a specialist.
Okay.
At earliest as possible.
Okay.
We have
It is not that only after 40.
No.
Okay.
In fact, as I told you, 30% of our young population are actually suffering with problems.
Okay.
So if you wait till 40, then you will probably have irreversible change in the joint which cannot be treated with exercises or conservative therapy. So it is always better to seek help if things are not getting better.
Okay.
Like
any minor symptoms, if you say.
If aches and pains which is not settling down for continuously, with rest and with basic exercises within a month, or when you are continuously working, you are under a lot of stress, or if you have injury to the joint which has not been taken care properly, these are the times it is always better to seek a specialist opinion. Particularly these type of conditions can be managed up to a large extent without surgical intervention. A lot of us have that belief that okay, if I go to a doctor, the doctor will ask for X-ray, MRI, or the doctor might suggest for surgery. No, that is not true. If it is at an early stage, majority of the time you can get better without medication also. So that's why having that awareness about your joint makes a lot of difference. So that's why we have health blogs nowadays. We have a lot of knowledge available in the internet about various conditions, and more than awareness, I would strongly suggest you to maintain your physical fitness. Once you are fit, you do not need to seek opinion from any doctors.
Is it better to consult a family physician or a specialist?
See, for minor aches and pains, it can be managed at that stage with a family physician. But when it comes to joint related problems, it is always better to consult a specialist, particularly if it related to knee, hip, back, neck, or shoulder joint. It is always better to see a specialist or see a person who is treating those kind of conditions, and then they can advise accordingly. As I told you, majority of the time, if it is detected at early stage, may not require surgical intervention at all. So having the fear to go to the hospital or the doctor might ask for any further investigation or surgery, that fear has to be tackled first. Then only your treatment becomes easier.
Sir, you have done a diploma in football medicine, right?
Yes.
So what pulled you to do that?
It is basically my passion to treat people with sports injury. Because as I told you, out of all the injuries...
Because MPT and BPT, is there a specialization on sports?
Yes. So BPT is basically a bachelor degree where you learn basic physiotherapy related work. Masters is basically the further step of super specialization, where there are various branches. So my specialization was related to orthopedics and sports injury. So, and when I joined Dr. Yogi's at KMC, I further developed the passion of treating sports injury, because that is where we can treat the patient and preserve their joint up to the fullest.
Yeah.
So there are obviously, as you learn more or as you treat more, you feel you need to step up with your skill and you have to further develop your skill set. That's why I got into football medicine, where the focus was to treat specific sports related conditions which can affect the lower limbs, particularly related to the knees, hips and ankles. So that's how I got into diploma in football medicine. And to take it further up, I got into my PhD, where my focus is to rectify their gait, so that we can get their natural lifestyle or quality of life preserved.
Okay. Sir, with all these experiences, are you planning to move away from here, or you will be settling in Karnataka itself?
So, of course, my passion is to treat patients and give them a better quality of life, preserve their joint. If I can avoid a joint replacement, that will be the biggest thing what I can offer to my patients or athletes. So of course, as a specialist and as we have a specialist center for hip and knee at KMC, I'm currently fully engaged and dedicated at that center. So definitely I'm here. Obviously I don't know what life has got plans for me, but definitely as of now there are no plans of moving out from Mangalore.
Okay, that's nice. Okay, so it was a wonderful, amazing talking to you, sir. It was a wonderful conversation. Definitely. I had been to one of the psychologists. So she also had given several remedies and several solutions for different psychological conditions. And you are the second doctor I'm interviewing. So thank you so much for giving us very wonderful insights on this particular topic, particularly for the young age arthritis.
Correct.
Definitely it should reach many youngsters and also the parents, so that they can go for the preventive measures so as early as possible.
Correct.
So
definitely if things are detected early, can be managed early as well, and we can prevent the joint getting worse. So the primary focus has to be maintaining your fitness. Do not neglect your injuries, and definitely seek specialist opinion as and when required, so that they can give you proper advice and things can be managed before it getting worse. So do not neglect and definitely take care of your health, madam.
Definitely.
Correct.
So thank you, sir. Thank you so
madam.
much.
Thank you.